Good morning, everyone. I'd like to call the meeting to order. The first order of business is the review and approval of the meeting minutes from the February 24th, 2023 Board of Health meeting. Do I have a motion to approve?
So moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The meeting minutes are approved. The next item is to review and discuss coronavirus COVID-19 update. Do we have an update from the Worcester Division of Public Health?
Yes, good morning, Mr. Chairman.
Good-
The COVID cases are relatively low as I speak this morning. In terms of the public health emergency will be ending at 11. We still have test kits available to residents, whoever's interested in having test kits. And we still have vaccination and still have incentive card to give a resident interested in getting the vaccination.
Okay, great, thank you. Is there any other comments in regard to COVID-19 from Dr. Abraham or from the city of Worcester?
Yes, this is Amelia.
Oh, hi.
Sorry, hi. Good morning, everyone.
Good morning.
Can I just say that we held 2 COVID clinics in March and at the fire station. We completed 27 total vaccinations. And along with that, we gave out 27 gift cards. This is from the state's incentive program. And they were $25 gift cards. That program ends at the end of this month. So I'm confident that we captured anyone who did want a vaccine, because I had slots for 36 to 40 people for each clinic. And we completed 13, 14 vaccinations per clinic. So I think at this point, unless there's a partner or a facility that wants a full COVID clinic, we'll just hold off for a while until we find out what the new guidelines are. And also the school cases have gone down quite considerably in the last 7 days. I only have 1 confirmed state case. That doesn't mean that there aren't more. People are testing at home, as we all know. So that's why if anybody needs test kits, we can supply them. So that's it for our COVID update.
Were the vaccinations, primary vaccinations, boosters, a combination of both?
Mostly boosters, the bivalent, 1 child, 1 secondary from the primary series.
Okay.
So mainly boosters at this point.
Okay, very good, thank you. Do we know what the state of the hospitalizations is right now in regard to COVID?
It's quite low. The number of hospitalizations directly attributable to COVID is extremely low. And we occasionally find patients who test positive either pre-discharge before they go to long-term care facilities. So I think our challenge or concerns more around long-term care facilities. You probably read in the news of occasional outbreaks in some of the long-term care facilities. So they are a vulnerable population, and so that's where probably the focus of attention rightfully is. But hospitals are also at a low. Wastewater surveillance is at a low. So all in all, generally low. We anticipate there might be some changes to the masking mandate in hospitals and healthcare facilities, but we await the state's decision in that regard.
Okay, great. Thank you, Dr. Abraham. If there are no other questions or comments, we'll move on to the next item on the agenda, which is to review and discuss updates from the Central Mass Regional Public Health Alliance. And Micah, do you have a...
Sure, I have just a quick update. We did have 1 foodborne illness complaint. I wasn't able to connect anything at the establishment to the illness. There was nothing else reported, but we'll keep an eye on that. Other than that, just 14 basic food inspections, very few complaints, and just getting ready for the spring, summer with camps and pools and all that kind of stuff. So,
Okay.
yeah, moving right along.
So what was this issue about the buckets of grease?
The plaza that has Total Wine and Chipotle and all that, someone had left 3 or 4 or 5 gallon buckets full of oil right next to the oil receptacle. Because it was locked, there's been theft of the oil at that plaza. But this time it looks like it was possibly dumped instead of stolen. So I'm working with the property manager on, he's the one who's kind of trying to make sure all the restaurants understand. I wasn't able to tell if the oil had come from any of the places in the plaza. And they're upgrading some of their trash facilities to try and prevent that from happening. They put up cameras to try and catch the thieves because they seem to leak oil every time they come steal the oil. They don't care if they spill it. So it's a work in progress. Hopefully we'll get them to put up an enclosure or something like that to make it a little more secure.
Okay. Great, thank you.
Yep.
Any other questions or comments from the board? No? Okay, if not, then I guess we'll just move on to the meeting schedule for the next meeting.
March, is April 21st an option?
April 21st works for me, and we'll have to check with Jenny, Kerry on that date, but that's April 21st. Yeah, that's good. Okay, given that, unless there's anything else anybody wants to discuss, do I have a motion to adjourn?
So moved?
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The meeting is now adjourned, and happy St. Patrick's Day, everybody.
Thank you.
Thank you.
Thank you.